This is Akashvani. In the program Spotlight, under our series 9 Years of NDA Government, now we bring you a discussion on milestone achievements of Jal Jeevan Mission with Vinny Mahajan, Secretary, Department of Drinking Water and Sanitation, Ministry of Jal Shakti, and the moderator is Gaura Dhawanlal, Akashvani correspondent.
Hello and welcome to our program. Today we'll be talking about the Jal Jeevan Mission. We are joined by Vinny Mahajan, the Secretary in the Ministry of Jal Shakti, Department of Drinking Water and Sanitation. The Jal Jeevan Mission has achieved a milestone of 12 crore tap water connections and continues to make rapid strides towards achieving Har Ghar Jal dream envisioned by Prime Minister Narendra Modi. Vinny, how significant is this achievement?
If we look back when the Prime Minister announced the Jal Jeevan Mission from the ramparts of the Red Fort on 15th August 2019, there were just about 3.23 crore rural households who had tap water supply in their houses. We were looking at almost 6 lakh villages in the country, and we were looking at over 19 crore rural households. So there was a massive task ahead of us. It was to be done in a very short time frame, and therefore this achievement. Let us also keep in mind that early 2020, the country, the world went through the pandemic with its own effects. There was a global impact of the global situation leading to price rise, etc. So the achievement is tremendous that today, with the strong and sustained efforts of the states and union territories, over 12 crore rural households, which is over 61%, already have potable drinking water of the minimum quantity, which is at least 55 liters per capita daily. The quality is defined as meeting the standards set out in BIS 10,200. And this water has to become available on a regular, sustained basis, day after day, year after year, even during the hot summer months when so many sources dry up.
And I think to maintain the quality with the really large targets that we have, I think it's quite a challenge. Any particular challenges that the JJM faced, and just a little more insight, because it's very easy to say we've reached a target, but for us to understand the how of it is also critical.
So we know that water is a state subject, and that is so because in our country there is such a huge difference to begin with the geological conditions. So we have all the way from the Rajasthan desert, for example, the snow desert in Ladakh. We have Himalayan mountain ranges where working is so difficult. We have islands where you need to reach water of acceptable quality and quantity. We have water-stressed areas where the water is either inadequate groundwater requiring massive surface water-based schemes coming in from the nearest river or dam. And we have geological contamination. So there are large parts of our river basins where there is water, but that water is affected by arsenic or fluoride and therefore not appropriate for drinking, cooking, etc. And the challenge of getting the human resource in position, because the departments that have been handling rural drinking water had never had the mandate, the responsibility to do so much work at such scale and speed while maintaining quality, and also in the context of challenges like the pandemic. So it's been Herculean task, and I must compliment all the states and UTs who have prioritized this, who have put in their best to achieve very difficult targets and done remarkably well, most of them.
Absolutely. I think a great example of really positive collaboration. In fact, Vinny, accessibility to clean and usable water is the basis for all health initiatives, also which are now coming on strongly across the country. So how have successes in the delivery of the JJM been reflecting in positive outcomes for other areas? Because it's linked to health, it's linked to welfare, it's a basic pillar of life.
Absolutely. We know that the most obvious and most significant impact of having tap connection giving you good quality water in your own home is on the women, because culturally, everywhere, it is the women of the household who have to make sure that there's water available, even if that means trudging miles every day and carrying water on their heads or in buckets, etc. So just getting the women rid of that drudgery, making life easier and safer for them, freeing up maybe some employment, freeing up the little girls to study, and the impact on health that you mentioned. We know that contamination such as arsenic and fluoride that a lot of people in our country were forced to drink leads to long-term health impact. It's a matter of great satisfaction that today there is no part of the country where people are forced to drink or cook with fluoride or arsenic-affected water. Either clean water through pipe sources has been made available, or while that is being done in the interim, community water purification projects have come up providing 8 to 10 liters per capita daily, so that can be used for drinking and cooking. So that's a huge step forward. There is strong emphasis on quality of water, and we know that bacteriological contamination in water results in the diseases, dysentery, cholera, all of that, gastric impact. And we know in particular that these kind of contaminated water issues affect our infants and children the most. So the renowned Nobel laureate, Professor Kramer, has estimated that the Jal Jeevan Mission will save over 136,000 child lives every year just by providing clean drinking water to households.
Vinny, these are very powerful figures. You said something which I think is probably a pivot on which, community engagement and development happens. You said the role of women, and women being 50% at least, or I think one of the criteria that you have of the Pani Samitis. So a little more if you could dwell on this.
So we know that without the community taking ownership for such infrastructure, we could just end up in a situation where the infrastructure is laid out, but the slightest of defect and people wait for a government official to come and remedy that.
Right.
And that's not what we want to see. We want people to see these assets as their assets, their ownership, and theirs to use and maintain and to benefit from. So one of the guiding principles of Jal Jeevan Mission is community participation, starting from the stage where village action plan should be made by the Gram Panchayats, but with the main participation of village water and sanitation committees, also called Pani Samitis in many areas. These committees have to have at least half of their membership should be women. There should be representation from amongst the disempowered also, because we know, for example, that this is a little bit of a social issue as well. If in a village there are some houses that have water and some that do not, often it is the disempowered who will not have water. So their representation in these committees ensures that the schemes that are made are ensuring saturation, full coverage. And then during implementation phase, we expect these committees to be vigilant, to be looking at the quality of implementation, and to be ready with adequate capacity building and hand-holding support, to be ready to take over the operation and maintenance of these schemes once they are completed. So we are urging all states and UTs to hand over completed schemes to the village communities, and that's being done at scale. We are encouraging that in particular women's self-help groups should be trained and should be enabled to take charge, whether it is in billing and collection or in operation and maintenance. We are encouraging the village communities that they must levy some appropriate user charges, not to put into the treasury, but for their own use, so that should there be some small leakage somewhere, some small defect in the motor or pump or something, they should not have to wait for funding from outside, and they should also not have to wait for skilled manpower from outside. So for that, we are working with the agencies of the Government of India and the states to make sure that every village must have a skilled person who should be immediately able to take up at least minor repairs and maintenance, such as leakages. So all these things have been built in. Therefore, this is a holistic approach, but in particular through engaging with and empowering the village communities themselves.
I'm sure there would be a grievance redressal system, checks and balances, somebody doing the oversight, so that the system which was set out with good intent, I think the authenticity and the rigor is maintained. That's also happening?
Absolutely. So one of the things we are very pleased about is that there is a massive MIS that has been put in place. There is a dashboard available in public domain. Anyone can open ejalshakti.gov.in and see what is the status in the country, in a particular state, in a district of that state, drill down to a village of interest to you and see which households have received water. So every head of household that receives water is Aadhaar verified and entered in the system, and this is visible to all. Apart from the transparency and the benefits that brings, we are encouraging all states. They have all put in place grievance redressal systems so that if the citizens do not receive water or do not receive it as per the requirements on time, etc., they have a way of getting their grievances attended to. So all these systems to make sure that the works that have been done continue to deliver to satisfaction.
Right. I think a lot of effort has also gone into ensuring that we maintain the quality is regularly checked. What really are some measures that have been taken so that all of us really understand the detailing that has gone into this project?
So I think we all recognize the importance of clean water, but how do we ensure that we get the water to be actually clean and to satisfy ourselves that it will remain of the right quality going forward? I must point you to the whole network of water testing laboratories that have been put in place. In the country today, we have over 2,000 water testing laboratories, and that information is again available in the public domain where anybody can go. These are not just for the departments, but anybody can go and get their water tested there and make sure that it is of the right quality. But more than that, without the communities understanding the importance of good quality water and therefore ensuring that the water continues to be of good quality, we will not really be able to achieve what we have set out to. For instance, in order to prevent bacteriological contamination, the usual remedy is chlorination. But the level of chlorine required in the water at the household end is usually a little higher than most people are willing to accept as appropriate. So they may complain that there is a smell or the taste is not okay and so on, whereas that is necessary, that level may be necessary. So how do you get people to understand quality issues? There is a huge effort in the country to provide field testing kits, which are simple high school laboratory kind of things, but those reagents available in the village with training to people and especially training to women to understand how to use them. Today, more than 20 lakh women all over the country in villages have been trained in understanding and using field testing kits. And so the idea is that the village communities must again be empowered to understand what is required of the water to be of the right quality and how can they test it and how can they be confident that this water is potable. So if it's not, then they will demand that and they will ensure that, and they should be empowered to have that delivered to them. This will set off a move. We will actually be able to drink from the tap without having to rely on ROs and filters and so on. And that is what we are working towards quality water, towards ensuring and giving confidence that the water is of the right quality.
I think that's a very comprehensive, in such a short time, I think you've given us great insight into what is happening in the Jal Jeevan Mission. Vinnie Mahajan, thank you so much for joining us on the show today.
Thank you very much.
You were listening to a discussion on milestone achievements of Jal Jeevan Mission with Vinnie Mahajan, Secretary, Department of Drinking Water and Sanitation, Ministry of Jal Shakti, and the moderator was Gaura Dhawanlal, Akashvani correspondent. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on Air. This program is also available on our YouTube channel, News on Air Official.